everybody. So this is Q&A Friday. We have a couple of questions, and I think it comes at a very opportune time because a lot of research is being done on autoimmunity, and I learned so much last week, and it's so hopeful for everything that we're doing or for all of us who have autoimmune conditions. So the first question comes from Cindy. She asks, she says, intense stomach pain after eating, have tried everything. Also 3+ weeks with UTI. First tried Cipro and had horrible leg pain, then doubled my Macrobid and the Omnicef and went to ER, have horrible pain and gave me 4 grams of Rocephin IV and have IC, and UTIs and kidney stones are nothing new to me. Urologist has put me on nightly Macrobid, 100 milligrams, prophylactic, but still get breakthrough UTIs. So this is a clear case of dysbiosis, and I think you've shared your issues with me for so long. This is exactly what we talked about. The microbiome in our gut and then the bacteria that lives within us is a real thing. So dysbiosis is a real thing for us with autoimmune conditions. That's first thing. And our microbiome that lives within us communicates with our genes and can wreak havoc in our bodies. And any bacterial or viral infection solution is an antibacterial or antiviral meds, which are in and of themselves very toxic. So this shift from healthy and sick really depends on decreasing the overall inflammation in our bodies. And I know I sound like a broken record, but we need a plan to get our bodies into an alkaline, anti-inflammatory state. So how do you do that? Well, take good quality probiotics, especially if you've been exposed to antibiotics, because you have to colonize the good guys. We now have the ability to look at not only who's living in our gut, but what they're doing in our gut. And the metabolic acids that the unhealthy microbiome produces as they metabolize in our gut further play into this unhealthy gut microbiota and keep you in this state of constant infection. And to add to this, eventually, because the bacterial species are able to mutate, they become resistant to the antibiotics, which is killing many patients around the world. So please do something about this. Get a good quality probiotic. You can surely, and I just think this is such a huge issue for you. And so I hope that you take my word and get yourself a good dose of probiotics just to counter effect what you're doing with the antibiotics. Okay. Second question comes from Susie Henson. She says, my question for Friday are, what do you recommend to stop hair loss? Also, can you go over the alkaline diet again, please? Just need to know how to do it. Thank you. Well, it's a good thing that you're thinking about the diet. As for the hair loss, that's been my big thing. Hair loss and my skin are my 2 pet peeves. I'm very vain, and I had alopecia at the onset of my lupus. So I found this supplement. I call it the Lupus Beauty Support. It's a mineral-rich formula as well as a collagen formula. It's miraculous. I can't go without taking those supplements, and I share them with you on my Lupus Pharmacy with an F site if you're interested. As for the diet, so there's no one-size-fits-all diet. A specific diet that works for me may not be the right fit for you. And the alkaline diet's premise is about balance and respecting your body. And before I even start on an alkaline plan for my patients, I first love to start with an elimination diet for a complete reset protocol to clean and restore their gut health first and foremost. And those of you who are in our private Facebook group, the elimination diet is under the files. The alkaline diet focuses on a balanced diet consisting of lots of colorful vegetables, think rainbows, and low glycemic fruits like blueberries, healthy fats, and good quality protein from organic sources that will shift your body into an alkaline state. That's all it is. And if you have lupus or autoimmune conditions, you likely also have leaky gut. We assume this. This is what I learned last week. And we now know that zonulin, a specific protein, is increased in those of us with autoimmune conditions or celiac disease. And zonulin becomes activated by gluten, and when this happens, it causes further degeneration of our gut, causing more permeability. So it's a good idea to go gluten-free for us. The next question comes from Victoria, and she asks, my fingers have such horrible blisters and I don't know what to do about them anymore. They always hurt and burn. Well, so the skin manifests, or the health of our skin manifests the health of our gut. And if you're getting blisters and they hurt, while we can assume that it's an irritation to the skin, it's likely a systemic inflammatory effect. In traditional Korean medicine, we believe that health of our skin is a direct reflection of our gut. I highly recommend that you eliminate any potential toxic foods by following the elimination diet, which is going to be ultimately anti-inflammatory. Once the inflammation is down, I promise, and then your gut is restored, everything will balance itself and slowly the skin conditions will disappear. I promise. So I think this is the last question. I don't know, is it Evie? Evie? It's a pretty name, but I hope I said that right. She asks, how do I know if my symptoms are from fibromyalgia or lupus? I have Raynaud's and I'm afraid of going to the hospital even when I feel so sick. We don't know if you have lupus or fibromyalgia without the clear serology check. And as for the definitive diagnosis, I highly recommend AVISE testing, AVISE, because it's able to rule out lupus from other autoimmune conditions. And also it gives us a prognostic view by following us and those biomarkers to make sure that we stay one step ahead of the game. It's by far the most intelligent and accurate test specific to us with lupus. So remember, when we go seek a doctor, we're looking for validation that we have disease. Often, for lupus or fibromyalgia, the dysfunction and symptoms precede the actual diagnoses, and there's an overlap of symptoms between the two diseases or conditions. I feel your pain, or I feel your irritation and frustration on your opinions about the hospitals, and I think unless it's an acute injury or unrelenting symptom, it's not very helpful anyway to go to your doctor. The better bet is to make sure you get your labs checked. As I mentioned, AVISE testing is a very good place to start. And keep yourself healthy. Don't wonder about what you have. If you're not diagnosed yet, I strongly believe, and this is why I do what I do and call myself the lupus rebel, because you still have the ability to turn things around. Don't wait for the diagnoses, because what it is once your lab serology or lab values can pick up these detectable antibodies, then that means it's already a full-fledged reaction. Autoimmune condition. So don't wait until that diagnosis is presented to you. I promise, follow the elimination diet or even consider our alkaline detox protocol and take these supplements, as well as go do the elimination diet if your funds are tight. But there's things that you can do to absolutely reverse this condition. I am positive of it. I learned last week that was absolutely possible. So I hope that gives you enough motivation to do more for yourself. There's a lot of research right now, cutting edge research, that we're not getting normally from our physicians, right? Because again, they treat our disease, not our health. So there's a lot that I'll be sharing in the coming months. So if you're interested in being in the loop, please go to my website, lupusrebel.com, and just opt into the newsletter, because it's going to blow you away what I'm about to share in the coming months. Okay, so have a great weekend. I'll see you guys next week.